Hey, and welcome back, Dr. Dave. Getting a lot of high anxiety, right? Symptoms of anxiousness, mostly situational, right? Now, the stress of the COVID-19 and everything that is coming along with it is enough to trigger a relapse of any medical illness, right? Arthritis in my case, could be many other things, heart disease, atrial fibrillation, chronic pain, skin diseases, whatever. It can also be sufficient in terms of external stressor to trigger a relapse of your mood disorder, depression, or bipolar, but particularly anxiety disorders. Those disorders would be include, not limited to, generalized anxiety disorder, panic disorder, obsessive compulsive disorder, post-traumatic stress disorder, social anxiety disorder, the simple phobias. If you have those disorders, then certainly this kind of stress could make them worse, trigger a relapse or recurrence, and necessitate proper medical treatment. That would be a prescriber. Go see your doctor, nurse practitioner, your PA, your clinician. And that's when I go in with medications often, right? What about, though, for just symptoms of anxiousness, as we like to say, brought about by life stressors? It happens to all of us. And it may fall short of the diagnostic criteria for one of those disorders. What do I do for those people? Well, you usually talk to them lifestyle. Make sure you're sleeping, of course. Watch your diet. Get your activity in, socialize safely with others. You know that drill, I've been through it many times with you. That's also then when I may go in with supplements, a Seroquel, particularly at night, to help build serotonin, help keep you sleeping, help take your mind off of the negative things, so designed to decrease kind of ruminations, obsessings, worry factor, fretfulness, those kinds of things. I usually support GABA as well in the form of GABA Boost, my go-to agents. That's just to decrease symptoms of anxiousness, help initiate sleep, etc., etc. I mentioned in a recent video that I also like to stick my nose in a good book once in a while. This is not the first time our puny little species has been threatened with extinction. What have the great writers over time done? What have they thought about? What have they written about? And so I'm always kind of reviewing that literature to tell me what great minds before have utilized to get them through such uncertainty. One passage that a good friend of mine sent to me late last week came from C.S. Lewis, and this was written in the 40s during the scare brought about by being in the atomic age, right? So nuclear war was a big fear on everyone's mind. And I want to read to you, right, something that he said. 1948, C.S. Lewis. This is the first point to be made, and the first action to be taken is to pull ourselves together. If we are all going to be destroyed by an atomic bomb, let that bomb, when it comes, find us doing sensible and human things. Praying, working, teaching, reading, listening to music, bathing the children, playing tennis, chatting to our friends over a pint and a game of darts. Not huddled together like frightened sheep and thinking about bombs. They may break our bodies, parentheses, a microbe can do that, end parentheses. Mind you, that was C.S. Lewis's parenthesis, not mine. A microbe can do that, but they need not dominate our minds. I'm going to reread that last sentence. They may break our bodies, a microbe can do that, but they need not dominate our minds. I took solace in those words, and as much as is possible, return to those sensible and human things. It's not complicated. Praying, working, teaching, reading, listening to music, bathing the children, playing tennis, chatting to our friends over a pint, maybe virtually, and a game of darts. So that, I think, is just good old time-tested wisdom Practice it. Let me know what you think. All right, that's kind of preachy, but you know, were I not a psychiatrist, I probably would have gone into the clergy. There you have it. Nice to be with you as always. I will see you next time. Until then, right? Read something, bathe those children. Can't really play tennis. Plus, I'm in the pickleball generation these days. But be sensible, be human, and I'll see you next time.